Hello and welcome back to Edu Skills OET Made Easy. Today we're going to dive into some essential grammar tips that will help you excel in the OET exam, particularly in the writing and speaking subtests. These tips will not only improve your language skills but also make your communication more clear and professional. So let's get started. Tense usage is the foundation of effective communication, especially in medical writing. Let's break down the most important tenses. Present simple. This tense is used for routine actions or general truths. For example, the patient suffers from chronic asthma. It's straightforward and commonly used when discussing a patient's ongoing condition. Present perfect. This tense connects past actions with the present. For example, the patient has experienced significant improvement since the treatment. It's perfect when you want to show relevance to the current situation. Past simple. Use this for actions that are completed in the past. For instance, the patient underwent surgery last year. Future simple. This tense is for actions that will happen in the future. For example, the patient will require follow-up care. Remember, using the correct tense ensures that your reader or listener understands the timing of the actions you're describing. Next, let's talk about the passive voice. It's often used in medical writing to focus on the action rather than who performed the action. For example, instead of saying the nurse administered the medication, you can say the medication was administered at 8 a.m. This shifts the focus to the action itself, which is often more relevant in a medical context. Conditionals are great for discussing potential or hypothetical situations. First conditional. Use this for real and possible situations like if the symptoms persist, the patient will need further evaluation. Second conditional. This is for hypothetical scenarios. For example, if the patient were to experience side effects, the medication would need to be adjusted. Conditionals help you discuss future possibilities and outcomes with clarity. Relative clauses are another powerful tool. They add extra information without starting a new sentence. For example, the patient who has a history of hypertension requires regular monitoring. This keeps your writing concise and informative. Subject-verb agreement is crucial for clarity. Make sure your subject and verb agree in number. For instance, the patient needs regular exercise is correct for a single patient, while the patient's need regular exercise is correct for multiple patients. Next, let's talk about articles. Use the definite article the when referring to something specific like the patient's condition has improved. Use indefinite articles a or an when referring to something non-specific or when introducing something for the first time, like the patient requires a comprehensive assessment. Correct use of articles can make a big difference in how clear your writing is. Prepositions are small but mighty. They indicate time, place, and method. For example, the medication was prescribed for hypertension, or the patient was admitted to the hospital on 5th August. Getting these right ensures that your instructions and information are precise. Linking words and phrases help your writing flow smoothly. Words like however, therefore, in addition, moreover, and consequently are essential for connecting ideas and making your communication logical and easy to follow. Adverbs modify verbs, adjectives, or other adverbs and express frequency, manner, time, and degree. For example, the patient was advised to take the medication regularly. Adverbs add detail and clarity to your instructions and descriptions. Proper punctuation is essential for clarity. Commas separate items in a list, introduce clauses, or set off non-essential information. Full stop periods indicate the end of a sentence. Colons introduce lists or explanations, like the patient has several concerns, pain, swelling, and restricted movement. Semicolons link closely related independent clauses such as the patient has been on medication for 3 months, however, there has been no significant improvement. Mastering punctuation will make your writing clear and professional. Reported speech is another important element, especially when conveying what someone else has said. For instance, the nurse reported that the patient had complained of dizziness. This is a common way to relay information in medical contexts. Finally, imperatives are used for instructions or advice. For example, monitor the patient's blood pressure daily. They are direct and to the point, which is essential in healthcare communication. And that's it for today's video on essential grammar tips for the OET. Remember, mastering these grammar points will not only help you in your exam but also in your everyday professional communication. If you found this video helpful, don't forget to like, subscribe, and hit the bell icon so you'll never miss an update. Thank you for watching, and I'll see you in the next video.